Hello, this is Dr. Dave Donohue with the Successful Aging Program. It is my honor to be with you today. We are going to talk about sleep. Sleep is fundamental to our health. This is actually a talk that I've given through the American Academy of Family Physicians, the importance of catching some good Z's. So it is directed at a medical audience, but I think that you will find it informative. So I would like to present to you my hierarchy of lifestyle needs. This is a theoretical model that kind of describes how important different elements of lifestyle are relative to each other, because it could be argued that purpose is maybe the most fundamental level of human need, followed by social support, followed by being addiction free, because if you're an addict, it's hard to achieve optimal lifestyle. And then it could be argued that natural sleep is really one of the most fundamental pillars of healthy lifestyle behavior. Because if we're not sleeping, then it's hard to eat well and move well and so forth. So sleep is fundamental. And what does a normal night of sleep look like? Well, we start with typically the deep phases of sleep, the stage four, occur earlier in the evening, earlier during the sleep, and then it's during the later period of sleep is when the REM sleep, the dream sleep happens. But it's important to get both. So here's a question for you. At the end of a lengthy office visit as a physician, a 60-year-old patient mentions her insomnia to you. You're the physician. She has mild daytime sleepiness. She denies snoring, cognitive problems, or depressed mood. She requests something to help her go to sleep at night. She currently takes only lisinopril for high blood pressure, and her blood pressure today was normal. What is the most appropriate next step? Should we recommend meditation for 30 minutes before bed? Should we request a 7-day sleep diary? Should we refer for dietary counseling to consume more whole plant-based foods? Or should we offer a prescription for Zolpidem 10 milligrams nightly? So what is the answer? Well, the answer is the sleep diary. And this is what a sleep diary looks like. So the consensus sleep diary is available online. You can Google that and you can download this document. And it's really basically like a little mini questionnaire or a sleep log that you can fill out on a night by night basis. So each column would be a different day, where you'd fill out all the information in this column, and then it continues here, in which you're answering fundamental questions about how you slept and how long did you sleep and how many awakenings did you have. And so this is helpful to be able to get some objective information of where are the problems with your sleep. It can be very enlightening for you, and you can bring this into your physician. So there are also apps that will do sleep diary like functionality. It's important that you do it 7 to 14 nights. It's important that you include both weekends and weekdays. Ideally, our sleep is fairly consistent across the week, but realistically, a lot of people's sleep is very different in the weekends. Note that we have our impressions of our sleep, but we're actually not as accurate about sleep as you might think. The correlation coefficient is about 0.6, meaning we're about 60% accurate in the things we say. So there's some truth, but it's not completely true, because our sleep can be deceptive. You don't really know how much you slept. So insufficient sleep is a common problem. Almost 30% of the adults in the United States report sleeping 6 or fewer hours. It's higher among younger adults and individuals with socioeconomic issues of lower socioeconomic status. People of color are twice as likely as white adults to experience sleep problems. And in a meta-analysis of 690,000 children in 20 countries, children's sleep was reduced by about 75 minutes over the last 100 years. So we doctors don't do necessarily a great job. About 70% of doctors were found that they never asked their patients' sleep habits or patterns, according to a survey in 2005. Another survey looked at medical schools and how much time is spent on sleep, and it's a very precious short amount of time. So the common sleep disorders, everybody's heard of insomnia, and usually people think of sleep onset insomnia where they have trouble going to sleep. Sleep maintenance insomnia or early morning awakening insomnia is another pattern where you have no trouble going to sleep, but you wake up too early. And so this is a case where your circadian clock is kind of set too early. We're going to talk a little bit more about that. Sleep apnea is a biggie, and it's underdiagnosed, and it's basically the disrupted breathing while sleeping that can result in snoring and pauses during your sleep and a host of medical problems. Chronic sleep insufficiency refers to people who can sleep just fine if they give themselves the opportunity, but they're not getting enough opportunity for a variety of reasons. And then finally, chronic altered sleep, which is sleep in which is disrupted due to the use of substances like alcohol or sleeping pills. Poor sleep is commonly associated with many conditions. So there's a lot of overlap between having depression and having insomnia. Having ADHD, or that's attention deficit and hyperactivity disorder, or just attention deficit disorder. And then you have PTSD, post-traumatic stress disorder, and then even hypertension. And the list goes on, actually. But a very large percentage of people who have some of these conditions also have sleep problems. So there's a little bit of a question is, which came first, the chicken or the egg? Did the sleep problem come first or the PTSD come first? So just a little bit of controversy there. So insomnia can cause obesity, and obesity can cause insomnia. This meta-analysis found that the risk of obesity was raised by about 55% for people who sleep less than 5 hours. And for each additional extra hour of sleep, it decreases on average the body mass index by 0.35. So it makes people a little bit less overweight to sleep better. Interestingly, this study found that it was increasing insomnia symptoms predicted back pain, but not vice versa. So it is the insomnia causing the back pain more than the reverse. So rising insomnia led to a 1.4 times increased risk of back pain. And also insomnia and poor sleep can contribute to even diabetes. A single night of partial sleep deprivation induces insulin resistance. So we can measure higher blood sugars the next day. And if you look at a longer time horizon, people who don't sleep well have higher rates of diabetes in the long term. So it's what we call a U-shaped curve, where people who sleep shorter periods of time and people who sleep longer periods of time, longer than 9 hours, have higher rates of diabetes. The people who have the lowest rates of diabetes are those who sleep 7 to 8 hours. So beware of sleeping pills. There are a host of studies saying that they seem to reduce memory formation, might contribute to more falls, more car accidents, impaired immune function, more illness, more cancer, which can result from an impaired immune function. The work of Daniel Kripke speaks to the risk of death related to sleeping pills, particularly the so-called hypnotics. So these are the pills that are typically prescription and controlled substances like benzodiazepines. These are sedatives, or the drugs like zolpidem. So all 34 of the studies that listed a mortality risk ratio found that the risk of hypnotic and anxiolytic use, that is to say those drugs I just mentioned, was associated with increased mortality in all but one of those studies. So use of those drugs is strongly associated with increased risk of death. And none of the studies report any evidence of protective effects. And it's interesting because we take a sleeping pill because we're worried I can't sleep, and so I'm not going to be able to function, so I'm not going to be as healthy, as cognitively healthy. But it turns out we don't have any evidence that sleeping pills improve your functioning the next day. Certainly not for that class, those hypnotic drugs. So think insufficient sleep when you think of conditions like major depression, ADHD, as we said, PTSD, as we said, chronic fatigue syndrome, chronic Lyme, fibromyalgia, chronic pain, and even memory impairment, starting to lose your memory, starting to develop dementia. Think insufficient sleep might be the underlying cause. And sometimes that person you encounter who's really testy, who's really short-tempered, they might be having poor sleep, because one of the side effects of sleep are not always drowsiness. It can include things like low energy, certainly drowsy driving, moodiness, irritability, and then, as we said, cognitive difficulties, trouble with memory, and as we said, pain. And I would consider some of these to be red flags, to the extent that if you have one of these things, you have a sleep disturbance until proven otherwise. If you work different shifts on a frequent basis, if you drink alcohol, particularly closer to bedtime, if you have a problem with snoring, if you have a history of sleep apnea, or if you have fibromyalgia, then the association is so strong that there's a very good chance there's a sleep disturbance. As we saw, PTSD is in that category too. So people who have more severe disease, they're the ones who need us to step in with more severe interventions. So desperate times require desperate measures, and so we need a bigger dose of an intervention. So if you find yourself, you have a real trouble sleeping, that's the time to really reach out and ask for help. I like this single item quality scale. So if you were to log one thing in your journal about your sleep, you could write down your number, your quality of sleep on a scale of 0 to 10. And this basically is looking back on a period of 7 days, and says, looking back on those 7 days, please think about the quality of your sleep overall, such as how many hours of sleep you got, and how easily you fell asleep, how often you woke up during the night, how often you woke up earlier than you had to in the morning, and how refreshing was your sleep. So if we're up at a 10 or a 7 or above, that's pretty good sleep. And if we're getting down below that 7 number, that means you're not sleeping well. There are trackers that will help track your sleep quality, such as the Oura Ring and the Fitbit and other devices. And they're getting more sophisticated. They will measure body temperature and oxygen level and heart rate throughout the night. So you can get a lot of insights with some of these trackers. Now, sleep apnea is a beast that we really need to pay close attention to, because 90% of people with sleep apnea have not been diagnosed. So it is a dramatically underdiagnosed condition. You can assess your own risk of sleep apnea by answering this quick 8-question questionnaire. It's all yes or no. Do you snore? So it's stop bang is the acronym, but do you snore loudly? Do you often feel tired? Has anyone observed you stop breathing or choking or gasping during your sleep? Do you have high blood pressure? Is your body mass index more than 35, meaning are you significantly overweight? Are you aged older than age 50? Do you have a large neck size, for men bigger than 17 inches and for women bigger than 16 inches? And finally, are you a male? And if your answer to 4 or more of these questions is a yes, then that puts you at a very significant risk of sleep apnea. So when you get a sleep study, they'll give you a whole bunch of reports and a whole bunch of numbers, but the main number, the most important number, is probably the apnea-hypopnea index, the AHI. So what does this measure? It actually measures the number of times per hour that your breathing was reduced by more than 30% for more than 10 seconds. So normal is thought to be under 5. So if you have an AHI under 5, that means you don't even have mild sleep apnea. OSA stands for obstructive sleep apnea. So if you're under 5, you're considered to be normal. As you get up to 15 to 30, that's considered moderate sleep apnea, and over 30 times an hour, which is once every 2 minutes, you have severe sleep apnea. I would argue the ideal really is less than 1. You really don't want to be having any sleep disturbances, and if you're anything more than 1, that means you probably are not sleeping to the extent that you could. You're not getting the rest you could, and ideally we would improve your sleep so that you do get that optimal rest. So how do we treat sleep apnea? well, this thing called positive airway pressure, or CPAP, um, and it can very much help for sleep apnea. The problem is a lot of people don't use it consistently. And across 69 trials, the majority of patients on CPAP were eventually non adherent, eventually stopped it. So, what could be even more first line for treating sleep apnea? Well, let's go through another question. In this case, a 66-year-old woman has been diagnosed with moderate sleep apnea. She developed it during the recent pandemic when she ate more takeout and gained 10 pounds. She suffers from significant daytime sleepiness. She drinks 2 cups of coffee per day. Which of the following is most likely to improve her condition? Is it switch to a whole food plant-based diet, enroll in cognitive behavioral therapy for insomnia, mindfulness-based stress reduction, bioidentical hormone replacement therapy, or reduce or eliminate coffee? And my answer to this question, there's several good answers, but my answer is to switch to a whole food plant-based diet. Now, why would I say that? Some of these things are very good for insomnia, but the thing about this woman is that we kind of know what happened. She gained weight. She kind of hit that threshold at which she was going to start developing sleep apnea. And so she got sleep apnea. So we have pretty good confidence that if she could lose those 10 pounds, the sleep apnea would go away. So the most effective way we know of for a long-term weight maintenance to improve your weight is to shift to a whole food plant-based diet. So that would be my answer for that particular question. And for sleep apnea, lifestyle factors are key. So for one thing, you want to be careful driving. And everybody with sleep apnea should be cautioned. Please, please be careful driving. You really are at risk for falling asleep. Some people get more sleep apnea when they're sleeping on their back, and there are devices you can purchase that you wear at night that prevent you from lying on your back. Avoid those sedatives. They can absolutely make the problem worse. Weight loss is key. Nutrition's super important. Exercise can help your sleep as well. Now, there's this idea of treating the root cause of airway problems. And so in my area, there's an author and a dentist and an airway expert named Dr. Ryan Robinson. And he wrote a book called The Root Cause. And this is my airway that it was imaged in his office. So they can do a low-dose CAT scan that will analyze the anatomy of your airway. But the point is that we can get at the root cause of airway problems. So oftentimes the ultimate root cause can be this underdeveloped jaws, which we commonly experience in the West. And if you know anybody who's had braces or needed to see the orthodontist, there's a very good chance that they've got an underdeveloped jaw because of a lack of chewing. Turns out we're meant to chew more in our youth and in our younger years, which causes hypertrophy of the jaw bones and the mandible, which causes a more open airway. But as a result of, it's just another disease of Western civilization, underdeveloped jaws, we have an obstructed airway, which can lead to all sorts of problems, from obesity to anxiety, diabetes, depression, headaches, and the list goes on. So there is the theory that airway problems can be a root cause of a whole host of diseases. If you want to find an airway specialist in your area, it's a little tricky because there's not one route to becoming an airway specialist, and there's not an abundance of people specialized in this field. But you can seek out the AAPMD or the AADSM and search for their diplomates in your region. There's a particular website on zmaps.com that you can go to search for this as well. The kinds of therapies that these folks will do include things like custom-fitted oral appliance, myofunctional therapy, weight loss, anti-inflammatory diet, breathing exercises, mouth taping. And beware that oftentimes insurance doesn't cover this. So some of the basic interventions that they commonly recommend are xylitol-based nasal sprays to open up the nasal passages, and surgical taping across the mouth at night to force nasal breathing. This should be done with caution with people who have particularly risky airway issues. On the topic of the most common causes of sleep disturbance, there's this notion of sleep hygiene. really engineering our sleep environment for optimal sleep. This particular study looked at 80 adults with insomnia who who received a single hour of sleep hygiene counseling. And what they were recommended to do was to get an 8.5 hour sleep opportunity and to follow a host of healthy sleep practices. And what ended up happening is that the people who went through got that 1 hour of counseling were able to improve their sleep by 1.2 hours a night, and were able to reduce their calorie intake, actually lost a little bit of body weight too. Here's the study. This is the control group. No major change from before to after the intervention. The intervention for the intervention group, as you see before, sleeping about 6 hours a night, after sleeping a little over 7 hours a night. A very significant improvement that happened the very first night after the sleep counseling. So the big thing there is an 8.5 hour sleep opportunity and a consistent bedtime and a consistent wake time and a fairly consistent bedtime ritual. So we have our own sleep hygiene handout, and I would recommend that you could follow the practices here, or you can search online to find the very best list of healthy sleep habits that you can find. Our list includes things like sleep and wake up at the same time every day. Get outside for sunlight on awakening, or you can use a light box. This can help orient our circadian clock to tell your brain it is morning time to reset. Exercise daily, especially outside. Hydrate in the afternoon and low salt at night. Avoid caffeine and chocolate after noon. Consider stopping all caffeine and chocolate in total if you're sensitive to caffeine and stimulants. Reduce or avoid alcohol. Alcohol is a very powerful fragmenter of sleep. No food within 3 hours of bedtime or in the middle of the night. When the sun goes down, start turning off or dimming the lights. Avoid artificial light of all kinds at least 1 hour before bed. If you have a TV in the bedroom, this is the opposite of optimal sleep hygiene. We would recommend move that TV out of the bedroom. Install light blocking window blinds. For some people, that early morning light can awaken them prematurely. Keep your bedroom cool. Set your bedtime to give yourself that 8.5 hour sleep opportunity. Try to avoid lying in bed awake. You don't want to associate the bed with wakefulness. Instead, if you find yourself awake in bed, get up and do something quiet in dim light, like reading. Avoid all sleeping pills. This cognitive behavioral therapy for insomnia can be a powerful tool if you can find a good therapist in your area. The consensus sleep diary is a great way of tracking how well you're sleeping. And certainly get that sleep study if there's any concern for sleep apnea. So here is our list again from our sleep hygiene handout. I wanted to talk a little bit about this idea of early morning awakening insomnia, because it's a different pattern and it's kind of the opposite in some ways. So as we get older, we're more prone to have this problem where you typically don't have trouble going to sleep at night, but then you wake up early. You might wake up throughout the night, but ultimately you typically are wide awake too early, 3, 4, 5 in the morning, when you really would rather sleep another couple hours. So the treatment is bright light therapy in the evening, because the problem with folks with this condition is it's a circadian clock problem. Your circadian clock is running a little too early. And how do you reset your circadian clock? There's no little dial on the side of your brain to reset your circadian clock. The way you do it is exposure to bright light. So exposure to bright light delays that melatonin spike at night, and it actually can be a little bit uplifting and a little bit activating. So you have a little bit more energy. You're not dragging through the night. You're a little more energetic, a little more upbeat and positive. And then when you do when it does come time for getting ready for bed, turn off the bright light, start dimming the lights, go into your bedtime ritual. You typically are not going to have trouble going to sleep, but you oftentimes, and the research suggests, you can sleep more than an hour greater duration at night. So you're looking for something like 10,000 lux for 30 minutes. Some of the research suggests even do it as long as 4 hours a night for a couple nights is enough to reset your circadian clock. So starting around 8 p.m. But people say, what time should I do this? The answer is whenever you start to fade at night, whenever you start feeling sleepy and yawning, get that bright light on and try to have it in front of you through the evening. So here is my ultimate approach to helping with your sleep. Step one is we want to look for any signs of sleep disordered breathing. So this is the most important thing. Is there any chance we have sleep apnea? Are we awakening? Do we have getting up to go to the bathroom at night? Do we have a dry mouth in the morning where we've been mouth breathing and maybe snoring? Do we wake up with headaches? Do we have daytime sleepiness? Do we have jaw pain or other chronic pains? We really want to think sleep apnea. That's where you really want to get a sleep study. And if you have the opportunity to get in with a airway specialist, they could take a look at your airway and see if it is collapsing at night. Step two is make sure we're not doing chemicals that worsen sleep. That includes alcohol, anticholinergic medicines. Some of the sleeping pills that are commercially available actually can disrupt the quality of sleep, and certainly avoid those hypnotics like Ambien or the benzodiazepine, the sedative drugs, which can be downright deadly. So if you are kind of hooked on those, I recommend try to abstain for 30 days and really double down on your sleep hygiene. Look for other root cause diseases like depression or pain. So if any of those are present, you want to treat it. In parallel, do the sleep hygiene stuff. So follow those healthy sleep habits that we just talked about. And then finally, be vigilant for the circadian clock imbalance. Is it possible that your circadian clock is off? And in particular, do you have that evening, early morning awakening insomnia we talked about? So that evening tiredness, in which case you want to use the evening light therapy. For people who have the opposite kind of circadian clock imbalance, where their circadian clock just won't let them go to bed until really late, you can reset your circadian clock to be earlier by starting melatonin in the evening and using the bright light therapy in the morning. So there it is. There's my approach for sleep. And I wish you a good night's rest. Thank you for your attention.